Hello everyone, welcome to my channel. I am Dr. Zina, a full-time dentist. If you are first time joining this channel, make sure to hit the subscribe button down below because it would really help me to do more and more videos. Today my topic will be talking about the steps of indirect pulp capping. Now, as the name suggests, indirect pulp capping. So there is an indirect exposure of the pulp. So not like the direct pulp capping, there is a pulp exposure. Here, there is no pulp exposure. The caries are about 1 millimeter close to the pulp, but there is no any pulp exposure. So the simple indication for indirect pulp capping, we have a deep carious lesion that is close enough to the pulp, but when you move the caries during the operative treatment, when you remove the caries, there's no pulp exposure. So once there is no pulp exposure and the caries are close to the pulp, so then the treatment will be indirect pulp capping. So the steps are similar to the direct pulp capping, but instead of placing the material over the pulp, over the exposed pulp, you will place it over the dentine, okay, in order to protect the dentine. Why? Because results showed that if you place a protective material such as an MTA or calcium hydroxide, there is a significant improvement within 24 hours. So you need to remove the caries fully. Once you remove the caries fully, apply MTA or calcium hydroxide, which is the dical material, as a liner, okay, in order to protect the dentine. And then after, you can place a TF, which is temporary filling, and recall the patient after 1 month, or either you can place a composite. Why you need to place temporary filling? Why not directly composite? Because sometimes the patient will complain of pain after treatment. So therefore, I recommend you to place temporary filling because you don't want to remove, put composite, and then the removal of the composite will become more difficult afterwards. So place temporary filling and then leave it basically for 2 weeks or for a month and see the results. Here, for direct or indirect pulp capping, I would prefer for you to choose an MTA. Why? Because it causes less pulpal inflammation. If you do not have MTA, you can provide or you can put calcium hydroxide, which is the name as dical. Thank you all for watching my video. If you enjoyed my video, don't forget to hit the like button, comment down below if you have any questions, and subscribe for more videos. Goodbye.